Hi, welcome to our class video for patient-centered care, where we're going to be talking about sexuality for birth control methods for ages 15 to 18 years of age for young women. We'll be talking about the pull-out method, the pill, Nexplanon, Depo, IUD, and Nuvarine. First, we're going to begin with Nexplanon. Nexplanon is a tiny, thin rod which is implanted into your upper arm. For example, right here in your arm. This implant releases hormones into the body, preventing from getting pregnant. It does not prevent from STIs. The Nexplanon is one of the most effective forms of birth control at 99% effectiveness. This birth control lasts up to 4 years. A nurse or doctor will insert the implant. First, they will numb the area where the implant is planted. Then they will make a small cut in the arm and insert a match size implant into the arm. And this is actually about the same size as what it's going to be in the arm. You will have some bruising after it's inserted for about a week, but it will go away and it will leave just a tiny scar. After a while, you'll realize it's not in your arm at all. The birth control will start working within the first week of the implant. If you have insurance, the implant is most likely free, but talk to your insurance before you get this. The risk of the implants are rare. Some include pain in the area where the implant is, infection, or a tiny scar. The benefits of the implant is effectiveness, makes your period better, which cuts down on the cramping and the flow. And it uses one hormone, progestin, which in some other form is used too. Side effects include spotting. If spotting occurs, the spotting will last for a while. So intrauterine devices such as Mirena are small T-shaped plastic devices that are inserted through the vagina into the uterus by a healthcare professional to help prevent pregnancies. There are strings at the base of the device that will extend through the cervix, and they should be checked for placement every month. If you cannot feel the strings or if the device comes out, you need to let your healthcare provider know immediately. Mirena works by releasing small amounts of a progestin hormone into the uterus, and this prevents pregnancy by thickening the cervical mucus, which makes it hard for sperm to get through the cervix, which in turn helps prevent the sperm from fertilizing the egg. This device also helps thin the lining of the uterus. Mirena has many benefits to it. It is one of the most effective forms of birth control, with it being over 99% effective. It is easily placed into the uterus at your local doctor's office, and it can be removed at any time if you decide that you do want to become pregnant. It can remain effective for up to 5 years before it needs to be replaced, so you don't have to worry about every single day, did I take the pill? What if I'm traveling, I have to remember to take it? That's not a problem because it's inside of you. You don't have to think about it. And it will usually make your periods lighten, shorten, or even stop. There are a few downsides to it. Some women will experience pain during or after the placement procedure. This is usually addressed by over-the-counter painkillers. The doctor will often just have you take like ibuprofen or something before he does the procedure. Dizziness and spotting can also occur, and if these symptoms do not clear up within a few weeks, be sure to tell your doctor. Less than 1% of users develop a serious pelvic infection called pelvic inflammatory disease, and although it's rare, Mirena can attach to or pierce through the uterine wall. You should contact your doctor immediately if you have persistent pelvic or stomach.
So the next form of contraception is the Depo-Provera, or the Depo shot. It's a 1 ml injection, 150 milligrams is the normal dose, that you get once every 3 months. It's safe and it's super convenient because you don't have to remember to take a pill every day. The shot contains the hormone progesterone, which stops you from getting pregnant by preventing ovulation. It's really good at preventing pregnancy, but it will not protect you from sexually transmitted infections, so you'll need to use something else like a condom to prevent that. You can start using the birth control shot whenever you want. If you get it within the first 7 days of the start of your period, you're protected from pregnancy right away. If you get it any other time in your cycle, you need to use another form of birth control for the first week after getting the shot. You have to remember to get a new shot every 12 to 13 weeks, but like I said, you don't have to remember to take a pill every day, and you'll just go to any healthcare provider and they'll give you the shot right there in the office. So you do have to make an appointment to get that injected.
Another form of birth control is the pill, which is taken orally once a day. The pill contains estrogen and progesterone, which inhibits the release of the LH and FSH hormones of the pituitary gland, which are hormones that develop the egg and prepare the lining of the uterus for the embryo to implant. This form of birth control must be prescribed by your doctor after taking a pregnancy test. If you are taking this medication, then you must take it the same time every day for it to be most effective. If you forget to take the pill, take it as soon as it is forgotten. If you have not taken your pill in a few days, contact your physician for directions of what to do next. Common side effects of oral contraception are mood changes, nausea, weight gain, irregular bleeding, and headaches. More severe, less frequent side effects are high blood pressure, blood clots, heart attack, and stroke. The pill increases risk for kidney failure and liver damage. You should not take the pill if you are breastfeeding due to decrease in milk production. Do not take the pill if you had kidney or liver damage in the past. The pill does not help with preventing STDs.
I'm Samantha Brown, and I will be talking about the NuvaRing today. The NuvaRing is a form of hormonal birth control that uses both estrogen and progesterone, and it is an intravaginal device that slowly releases the hormones over time. It's about 98% effective, and it is placed in the vagina and stays there for up to 3 weeks, and then you take it out after 3 weeks to have a normal period and reinsert it after period. You must do this for it to be most effective. If you forget to take it out when you're supposed to be having your normal period, then it can it doesn't cause any harm to you, but it is not going to be as effective. The risk and side effects, the major side effect or risk would be blood clots because of all the extra hormones in your body. And the most common side effects are like tissue irritation in the vagina, headaches, mood changes, the ring slipping out. Occasionally it will move depending on how your vaginal muscles move. You can have it in during intercourse if you so choose, or you can take it out. It will still be effective as long as you put it back in right after sex. People who should not use the NuvaRing are smokers and people over the age of 35, or have had blood clots or high blood pressure. And people with diabetes or Hep C should also not take this form of birth control. That's the NuvaRing.
My name is Maggie, and I'm going to be talking about the pull-out method or the withdrawal method. It is most effective when combined with another method of birth control like condoms. It doesn't prevent sexually transmitted infections. When used the right way, meaning removing the penis before ejaculation, 4 out of every 100 women will get pregnant. Realistically, about 1 in 5 women get pregnant using only the pull-out method. The benefits are that it has no side effects, it's free, and it enhances pregnancy prevention with other methods. The downfall is that it is not very effective alone and that it takes a lot of self-control.
Do you want to go up closer so that you can show?
See,